Benefits of artificial intelligence in healthcare. The history of the word disease goes back to the 16th century. But as diseases were there since the beginning of life, healthcare has to develop to match the speed at which these diseases get aggressive. This is where we talk about how AI is helping us in the field of health. So welcome to Medilab Zone, and let me tell you the benefits of artificial intelligence in healthcare. There are numerous potential applications of artificial intelligence in the disciplines of medicine and healthcare thanks to developments in analytical and computing techniques and the explosion of data in healthcare organizations. So let's start with our list. AI helps with, number 1, surgery. AI has helped in achieving great success in robotic surgery. Robots can now do delicate surgeries with the advancements in electronic technology. The robot is still operated by the surgeon, but it can perform micro dissections and access tiny areas that a human hand would find impossible. Robotic arms are capable of performing intricate procedures on the brain and heart with absolute accuracy. This has been demonstrated to lessen complications and the danger of blood loss. As all data from robotic procedures can easily be stored in digital media, it helps with surgeon education and training. Number 2, medical imaging. AI solutions used in medical imaging support labor-intensive image scanning and case triage by surfacing valid insights that can help radiologists identify critical cases first, make more accurate diagnosis, and possibly avoid errors while utilizing the breadth and complexity of electronic health records. Large datasets with hundreds of photos can be produced by a conventional clinical trial, creating huge volumes of data that need to be reviewed. As studies from the entire healthcare sector can be examined for patterns and hidden links using AI algorithms, it speeds up the process of finding important information for imaging specialists. Number 3, diagnosis and treatment. For the past 50 years, disease diagnosis and treatment have been at the center of artificial intelligence in healthcare. Even while early rule-based systems could effectively diagnose and treat disease, the clinical practice did not fully embrace them. They weren't noticeably more accurate at diagnosing than humans, and the interaction with physician workflows and health record systems wasn't great. However, whether rules-based or algorithmic, it has now been integrated into clinical practice for diagnostic purposes and making treatment plans. So now, medical software suppliers offer a large number of independent AI and healthcare capabilities for diagnosis and treatment that are focused on a single discipline of medicine. Number 4, accelerated drug development. The conventional methods of producing medications can frequently be unreasonably expensive and time-consuming. This presents a significant obstacle, as we can never say when the next pandemic would hit us. Usually, treatments are typically tested in clinical settings for $2.6 billion, and only 10% of those drugs are subsequently sold. In 2007, a robot called Adam could combine billions of data points in investigating the diverse roles of yeast to identify the 19 genes that make up yeast and forecast 9 new, precise ideas. Eve, another robot, discovered that triclosan, a substance frequently present in toothpaste, is efficient against parasites that are related to malaria via a study. Such discoveries make the manufacturing of medication fast. It also costs a fraction of the past cost, proving that AI has a sustained and expanding significance in the area of medicine. Number 5, expanding access to healthcare in underserved regions. A lack of qualified medical professionals, such as radiologists and ultrasound technologists, can severely restrict access to life-saving care in underdeveloped countries all over the world. But AI can help with this by taking over some of the diagnostic tasks traditionally assigned to humans. If I combine this with medical imaging, it is like this. As an example, AI imaging technologies may frequently achieve a level of accuracy equivalent to people when screening chest x-rays for indications of tuberculosis. A skilled diagnostic radiologist wouldn't necessarily need to be present if this capability could be implemented through an app made available to healthcare professionals in underdeveloped regions. This way, AI can beat the medical professional shortage in rural areas. Number 6, clinical decision-making. The time and resources required to assess and diagnose patients can be decreased by using artificial intelligence in some healthcare activities. This allows medical professionals to respond more quickly and save more lives. Algorithms that use machine learning can identify danger much more accurately and quickly than traditional procedures. When implemented properly, these algorithms can speed up diagnosis and reduce diagnostic errors. Also, AI-enabled technologies can assemble and sort through vast amounts of clinical data to give doctors a more comprehensive picture of the state of patient population's health. With the help of these technologies, the care team may obtain timely or nearly timely information that can be used to improve patient outcomes. Number 7. Data collection and administrative tasks. You might not know that more than 2/3 of a doctor's time is spent on paperwork. An additional 2 hours will also be spent on documentation for every hour spent with patients. This is a huge waste of their time. This can be solved with an AI that can reduce the stress of data collecting and free up the time of doctors and employees to focus on other activities. The same goes for administrative tasks. AI is a potent administrative worker. We can use it for prior authorization, clinical recording, revenue management, medical record management, schedule optimization, and billing and claim processing. AI can identify a patient's health plan, medical benefits, and the services that go with those benefits, and require authorization. AI can also assist with the gathering of paperwork, such as patient histories, data, and medical approvals. Number 8. Getting real-time data. We need reliable data on time to identify the problem and solve it as soon as possible and using the most effective way. AI can help doctors and other medical professionals make critical therapeutic decisions more quickly and effectively by using real-time, precise data. Producing more quick and realistic results can reduce patient wait times, improve preventative actions, and reduce costs. Real-time analytics can support stronger physician-patient relationships. If important health information is made available via mobile devices, patients will be more involved in their treatments. Through cell phone notifications, doctors and nurses can be informed of life-threatening changes in patient status and emergencies. This process has become easy as almost all people have access to gadgets with sensors that can gather important information about their health. A growing amount of health-related data is produced on the go, from wearables that can monitor a heartbeat constantly to cell phones with step trackers. This data can be gathered, analyzed, and supplemented with patient-provided data from apps and other home monitoring devices to provide a distinctive view into both individual and population health. However, it might be necessary to put in a little extra effort to assist patients to feel comfortable sharing data from this close, ongoing monitoring. Number 9. Providing virtual nursing assistance. As we all do, 89% of US people also Google their symptoms and self-diagnose their problem before seeing a doctor. As these diagnoses are not correct, this useless act can be prevented using virtual nursing assistants. They keep track of patients' health metrics, prescription usage, and lifestyle choices using AI healthcare analytics to stop the progression of chronic illnesses and make necessary visits. It tracks a patient's weight, blood pressure, and other parameters produced by monitoring devices and is represented as an avatar that offers remote support for common medical issues. Molly is a prime illustration of such a multifaceted virtual nurse. It allows you to simply schedule a doctor's visit and privately discuss any health demands they may have. 64% of patients feel more at ease getting instructions from Molly. We get outperformed by these virtual nurses as they have 24-hour access to medical assistance and can monitor all the patient's conditions continuously. Number 10. Research. AI enables researchers to gather enormous amounts of data from numerous sources. The capacity to use a big and expanding data collection allows for more precise analysis of fatal diseases. These researchers can profit from the abundance of data that is currently available. Technologies that will aid medical practitioners in managing enormous data sets are also being developed by groups engaged in medical research. While those are the general benefits of AI in healthcare, we can't skip saying how much it helps to reduce the stress of medical practitioners. Deadlines and other work-related variables put a strain on more than half of primary care physicians. But as AI helps to streamline processes, automate tasks, share data quickly, and organize operations, they now don't have to juggle too many tasks at once. So yes, AI does so much in the field of healthcare. Hope that was educational. Then give a thumbs up if you think it was useful. So, until we meet again, bye-bye.